Hi, I'm Michael Matusis, medical psychotherapist with the UCLH Neuropsychiatry Department and clinical lecturer in neuroscience with University College Hospital. And today I'm going to talk to you about the cognitive-behavioural therapy approach and how it fits in with the management of functional neurological symptoms. And I'm going to talk about this topic under the heading of the 5 areas approach, which is the title that it has in the book that we recommend as well. So, as usual, I will start by recapping some of the material that we have covered before, and then I'm going to give you an overview of the session today and take it from there. So here goes. In the previous session we talked about goals. Arguably this is the most important part of this series of talks. So we introduced goal setting and we mentioned that goals need to be specific, measurable, achievable, realistic and timed. And basically all these things make sure that it's actually a rewarding experience striving for your goals, that you can do them and that they actually depend on you, they don't depend on other people or the weather, whatever. We talked a bit about assessments last time and in particular about this problem that can appear bewildering about where you start. How do you make a good start on your goal setting? We talked about therapy and occupational therapy in particular, dividing daily activities into the more essential ones that we talk about in terms of self-care. The ones that are more or less the things we should do, we have to do, are our duties, which we call productivity, and the more pleasant things in life, which we called leisure. We ended up last time by suggesting that you set different levels of goals, some short-term for the week ahead, some slightly longer or rather medium term for the next few weeks, and in particular we talked about you sort of thinking a bit about the inpatient treatment, what goals you may have for that. So what about today's session? Well, we're going to introduce the cognitive behavioural approach as mentioned, and I'm going to actually try to link it with the goal setting gradually as we go along, although initially it may not be apparent what the links are. And I'm going to talk about these 5 areas that we're talking about, which are symptoms, thinking, feeling, behavior and life situation. We're going to go into detail into each one of these, and of course I'm going to finish by suggesting some homework. So the cognitive behavioral approach tries to get a holistic view of the person, to think of the wider environment, our social selves, what happens in our family, finances, housing and so on, and then what our experiences and thoughts are, what our psychological self is like, what we think and feel, and how all this is underpinned really by our body and our bodily functions. So the goal of cognitive behavioural therapy itself is develop skills so that each of these areas works with, not against, the others towards our goals and your goals, and more specifically your rehabilitation. And they may not actually work together when someone has been unwell for a long time. So in the 5 areas approach, what we do is we assess how what's happening in these 5 areas affects your life. So what are your symptoms? What are your key symptoms? how your thinking may have been affected by being unwell. We would call that altered thinking. What about altered feeling? Changes in the way you feel about yourself and about your symptoms. What about changes in what you do, altered behavior? And of course, how all this fits into your wider life situation. So we make a big deal in CBT and in the and in the 5 areas approach, in the rehabilitation application of it, about how these affect each other. It's not just that the one goes to the other, symptoms go to altered thinking, to feeling, to behavior, but they actually have multiple links. So this is a diagram of these links, of these 5 areas, and how they affect each other. So you see that we have put the life situation, relationship and practical problems, the wider situation as an umbrella. And underneath we have, for example, symptoms affecting behavior, but also symptoms affecting how you feel. And so on and so forth, all being linked with each other. And this may look rather theoretical, and rather complicated. So I'm going to talk a bit about it with the help of an example from the book Overcoming Functional Neurological Symptoms, which I suggest you look at yourselves. So the example is a 41-year-old woman who is a mother, and she suffers from the flu. So in the context of that, she has aching limbs, she suffers from a cough, she has temperature, she feels tired, no energy, and no appetite. So how has this affected her life situation? Well, she's off work due to illness. And has this had repercussions? Yes. In her work, she has problems receiving sick pay. So you can see that things have started to escalate. So now we're going to look at how these basic illness and life situation may affect different areas of her life. So what about her behavior? Well, Mary sits there and says, I've been staying in bed and I've been keeping my night clothes on and I can't work, and I'm not using my usual chores, sort of looking after the children properly, and I'm arguing with my husband because he's not helping enough now that I'm unwell. I expected more. So you can see how she may have thoughts about this situation. In fact, it would be very strange if she didn't have thoughts. So some of the thoughts she has is like, how am I going to pay my bills? But also some which are less about the fact, like, why is it always me that gets ill? And some which are about assessing the situation, like the children are being neglected, and of course these thoughts will affect how she feels. So she may feel guilty about the children being neglected. She'll feel unhappy, certainly, because of all this that's been happening. She may be tearful, so her emotional feeling may be sadness, and these will affect the other areas as well. So, for example, feeling guilty and unhappy and generally terrible psychologically isn't exactly going to help her sort of tiredness and sort of energy levels, and it's not going to help motivate her to get out of bed and change. Maybe it may actually make these things worse. So you can see that some of the thoughts and feelings that Mary has about this very straightforward illness may be helpful towards her getting better, and some actually a lot less so, and may in fact contribute to her feeling worse, to her quality of life being worse, and vice versa. So now we come to the first exercise of this session. So first of all, I'd like you to spend 10 minutes studying the 5 areas example of Mary, either in the book or in these slides, and jot down some examples from your own life relating to your own symptoms about how these areas may affect each other.